Pfizer CEO says fourth COVID vaccine doses may be needed sooner than expected due to Omicron. Pfizer CEO Albert Bourla said Wednesday that people might need a fourth COVID shot sooner than expected after preliminary research shows the new Omicron variant can undermine protective antibodies generated by the vaccine the company developed with BioNTech. So in like 4 weeks, right? They've already figured this out. Pfizer and BioNTech released results from an initial lab study Wednesday morning that showed a third shot is effective at fighting the Omicron variant, while the initial 2-dose vaccination series dropped significantly in its ability to protect against the new strain. Okay, so let's look at the results. Oh, look. There's no lab results attached, is there? Where's the lab report that I can look at? Where are the people that they've studied in the last 4 weeks? The data comes after a small preliminary lab studied by South African scientists. See, I don't know how, where's the data? Where is it? Okay, so it's not here. So that right there is some beautiful truth being told to us by Pfizer, right? They released the results where? However, the 2-dose series still likely offers protection against getting severely sick from Omicron, the company said. Bourla noted that a preliminary study by the company was based on a synthetic lab-created copy of the variant, and more data is needed from tests against the real virus. So I'm going to say it again. Bourla noted that a preliminary study by the company was based on a synthetic lab-created copy of the variant, and more data is needed from tests against the real virus. Those real-world results will be more accurate and are expected in the next 2 weeks, the Pfizer CEO said. When we see real-world data, will determine if the Omicron is well covered by the third dose and for how long. And the second point, I think we will need a fourth dose, Bourla told CNBC Squawk Box. Bourla previously predicted that a fourth shot would be needed 12 months after the third dose. With Omicron, we need to wait and see because we have very little information. We may need it faster. So all of this is coming to you, right? What is it coming from? Synthetic. It's coming from computer models. They're not taking it out of anybody's body and sticking it in a dish and seeing if it attacks anything. They've never done that with any virus, actually. Look it up. The Pfizer CEO said what's most important now is to roll out third doses for the winter. Public health officials are worried about a spike in COVID infections as people gather more indoors to escape the cold. A third dose will give very good protection, I believe, Bourla said. He said that treatments such as Pfizer's oral antiviral pill Paxlovid will help prevent hospitalizations and control COVID during the winter. Pfizer submitted its application to the Food and Drug Administration last month for emergency authorization of the pill. Bourla told CNBC on Wednesday that Pfizer will have the full results from clinical trials in days. He expects the pill to demonstrate an 89% reduction in hospitalization and death as it did in interim data last month. The Pfizer CEO said the company has already shipped the pills to the U.S., and they've already shipped them. They've already printed them out, right? They've already got it here if the FDA approves it for emergency use. Now, how real is this process if a company, they already know that it's going to be approved, or they wouldn't have wasted millions and millions, maybe billions of dollars making these pills and then shipping them everywhere, would they? If the FDA approves it for emergency use. President Joe Biden said last month that the U.S. has bought 10 million courses with deliberately stated to start by year end. So we already bought them. Joe Biden, these people have already bought the pills, and they're not even FDA approved yet. What are the chances that they won't be approved by the FDA? Burla said he's confident the Pfizer pill will remain effective against Omicron because it targets a different part of the virus, an enzyme used for replication that is not as susceptible to mutations. The vaccines target the spike protein of the virus uses to invade human cells. The spike protein is mutated repeatedly over the course of the pandemic. I would like to see that. I need to see this, not in a computer model, but I want you to show me in a petri dish a virus attacking a cell. Not coming out of a cell, but actually I need you to show me just a piece of genetic material and how it gets the energy. Right? It doesn't have any organelles that, give it any sort of energy. I need to see how that happens. All right, without any poison, without any monkey, kidney virus, whatever. I need to see the specific piece of genetic material. I need to see it come to life and attack something. Someone needs to show me that. Pfizer and BioNTech can develop a vaccine that specifically targets Omicron by March 2022, should that prove necessary, Burla said. He said he anticipates new variants to emerge in the future, and the company is monitoring to see if vaccine adjustments are needed. COVID surge is gripping New York City, so almost everybody is vaccinated there. We've never seen this before. CDC shows that Omicron is spreading fastest in New York and New Jersey. On December 12th, the COVID-19 test positivity rate in the city was up 7.8%, up from 3.9% just 3 days before, according to Dr. Jay Varma, top health advisor to Mayor Bill Diaz-Holio. We've never seen this before in New York City, he tweeted. Leadership via tweet. Amazing. Positivity rates are rising as the Omicron variant spreads. It's amazing how well these vaccines are working. Do you not agree? It is amazing. I can't believe how well they are. Everyone should go take this, right? I mean, look at how good it's going in New York, right? The percentage of positive tests in the city went up from 3.9% to 7.8%. This is amazing, right? Like Pfizer, AstraZeneca, all these people. I mean, look at how well their product is doing. It's awesome. He also noted that about 67,000 PCR tests are administered in the New York City per day, which is higher per capita than many other communities or cities across the country. Don't wait. Get your booster. Yes, you should get your booster right now. It's helping. It's, all of these vaccines, they work so well. Let's not underestimate this variant because it's very scary. Experts are warning that the strain could be easily mistaken for a mild everyday illness. Yeah, I mean, you wouldn't want to mistake COVIDs for the common cold because that would be completely wrong. Health officials warn people to not underestimate the Omicron variant. Symptoms associated with COVID-19 Omicron variant could be similar to those that normally accompany a cold, but experts are warning people that they should not underestimate the risk posed by the more transmissible strain. Yeah, I mean, if you have a cold, you need to go to the hospital and you need a dosage of remdesivir and also midazolam, right? Because God forbid you just take some NyQuil or you drink a hot toddy with some whiskey in it and you wrap up and you go to bed. If you did that, you need to go and you need to take 2 shots, right? And then you need to go get the booster and then the next booster. And then, you got to make sure that you take the quantum dot tattoo as well. It's coming. Omicron symptoms are predominantly cold symptoms, runny nose, headache, sore throat, and sneezing. So people should stay home, as it might well be COVID. I am just really impressed at how, right, so on Black Friday, they announced Omicron that came from Africa. I mean, it's cool that they color coordinate it, like Black Friday and then black people in Africa. It's pretty cool, isn't it? Didn't they do a good job? And then by Monday, they've already developed a test for Omicron, right? So they could tell you that you had it. And they shipped it all around the world so that, you could know. I mean, how on it are these biotech companies? I mean, they're just amazing. They do what is impossible to everybody else, right? I mean, they do what's impossible all the time, and it's amazing that they can just report on it. Right? Early small studies show that while it's more virulent than the Delta variant, it might cause less severe infections. I mean, it is so amazing how someone, in a hospital in Timbuktu with Omicron can spread it all over the world, and then they can get all the data together in 4 days, right? We need to trust our overlords more because they care about us, right? They really do. They're doing so much. Look at this. The UK reported its highest number of COVID cases since the pandemic began with 78,610 new infections. The vaccines are working. It's working, y'all. If we just take every vaccine they give us, maybe we'll have more infections, right? I mean, because it's 95% effective at something, right? It's effective at something. I haven't figured out what it is yet, but I only have a degree in chemistry. I'm not a doctor, okay? I was looking for these studies, right? I can't seem to find anywhere where they actually released a study that I could read and, 13% could be, this is an estimation, right? So a friend of mine's a nurse and said that to figure out the Delta variant, they gave you the same test for COVID and then they sent it off to the CDC, and the CDC is the person that told you that you had the Delta. I mean, that's pretty amazing. I guess that's what they're doing with Omicron. I don't know. All I know is, thank God, we're listening to the media and to our illustrious leaders, and Big Pharma, I know they love us. All right, y'all.